How are you? I hope you're fine. Today we're gonna take uh, section 3 of consciousness. So let's start. I'm talking here about what? About here the altered states of consciousness. How I can use the altered states of consciousness, how they can be achieved while we are awake. Through what? Through three things that we're gonna study: biofeedback, meditation, and hypnosis. Hypnosis. There are many myths surrounding the hypnosis. So, what does it mean? Myths here? It means um, mistaken things, mistaken thoughts about here the hypnosis. Although there are controversies related to the use of hypnotism, hypnosis can be used too. We are here recalling the memories. We are trying to reduce the pain and quitting the bad habits. Through what? Through the hypnosis. So, I have here the main idea. We're gonna use a variety of techniques that have been already developed in order to achieve altered states of consciousness. So, we're gonna talk about the meditation, and I know that a lot of you have heard before about meditation and biofeedback. And we talked about biofeedback, and I sent you a video about the biofeedback, how it helped a small child for healing him from or curing him from constipation. Can you remember? What's hypnosis? And I'm gonna talk about what's meant by hypnosis. How can hypnosis be used? So let's see this picture. This is a poster. This is a poster here advertising a hypnotist. Hypnotist here, people under his influence engage in odd behavior, strange behavior. A woman plays a table, as you see here. She's acting as if she's playing a table instead of a piano. A man who's here rides a chair like a racehorse, and so on. I have here the meditation and the biofeedback. When I talk about the meditation, we what comes up in your mind when you hear the word meditation? We all feel relaxation. So I'm having here what? I'm having here people use meditation to narrow here their consciousness, to focus their consciousness. Okay, guys, uh, so that out, the stress of the outside world fades away. Fades away. It means goes away, or you can escape the world here by using just the meditation. Evidence suggests here the meditation can help people to relax. So I'm helping people to do what? To relax by using the meditation. Studies have found that meditation is very effective way to lower the blood pressure also, because you are just relaxing and relaxing, and we know that the high pressure comes from the stress. Okay, and we talked about before the biofeedback. Remember, it's a technique or a system that provides or feeds back data about something that's happening inside your body. So I am here bio. Here it means that something biologically happens in your body. People have used biofeedback to treat what? Headaches, constipations, a lower blood pressure. Biofeedback has been used to treat also very important disease, which is ADHD. Very important question here to mention. I'm using in the biofeedback. Do I use here drugs? Of course not. We are not using drugs. We have here a question. What do meditation and biofeedback have in common? Meditation and biofeedback have what in common, guys? Both are methods for achieving altered states of consciousness. So, when we talk about hypnosis, myths and realities, or myths versus realities, hypnosis is a condition. I'm going to make you sleep. This is a right thing about hypnosis? No, it's not. Is a condition in which people appear to be highly suggestible and to behave as if they are in a trance. Some psychologists believe that hypnosis is an altered state of consciousness. Others wonder whether hypnosis here is truly an altered state of consciousness or not. The history of hypnosis. Hypnosis dates back to the late 1700s, in the 17th, with the work of whom, and this is important name to remember, Franz Mesmer. Today, doctors and psychologists nowadays they are using the hypnosis in a variety of ways as an anesthetic to help reduce the anxiety, to help the manage pain, and to overcome the fears. Achieving hypnosis, professional hypnotists may put people in a hypnotic trance by asking them to focus on something specific. They are asking them to do what? Please focus on something. And they keep the psychologist or the hypnotic keeps telling people to focus on something. Then, people who are easily hypnotized are said to have hypnotic suggestibility. Okay, guys. So some people have high hypnotic suggestibility, and some others do not have this thing. Explaining hypnosis. I have here Freud's explanation. Hypnotized people put fantasy and impulse before fact and logic. So, according to Freud explanation here said that hypnotized people put the fantasy and also the impulse before fact and logic. Okay, they imagine things. Therefore, they believe what the hypnotist tells them. Okay, so they are more imaginary people who I do the technique on. The role theory explanation, and I have another explanation called the role theory explanation. Hypnotized here people are playing a part as if they are in a play, unlike actors. Okay, unlike the actors, however, hypnotized people may believe what they are doing is real. So they believe that what they are doing is real. Okay, they think that they are in a play, but unlike the actors know that they are just acting, but the people there, they know that they are not actors, and they are not here acting something or pretending something. They know that this is real, or they believe that's real. There is no one generally accepted explanation for hypnosis. Okay, guys. Okay, so I have here the differences between the myths and facts about hypnosis. I have a lot of myths about or false beliefs about here hypnotism. Some of the most common myths are listed below along the facts, and we have also the facts. So the myths here, you can be hypnotized against your will. What do you think? This is right or wrong? This is correct or just false beliefs? It's a false belief, of course. No, and the fact is no one can be hypnotized unless he or she is willing to do so. When hypnotized, you can't open your eyes. The fact is, being hypnotized dulls but doesn't fundamentally affect the normal function of all of the senses. I can open my eyes, I can close my eyes, I can use all my senses. They are functioning well. You cannot remember your own name. No, you can remember everything you normally remember. You act out scenes from childhood. You don't typically act out scenes at all. You behave in unusual ways. In unusual ways? No, you usually behave quite normally. You behave normally, in a very normal way. You will do anything the hypnotist will ask you to do? No, of course not. You're unlikely to do anything you wouldn't normally do. you go into a sleep state? Of course not. You stay conscious and relatively alert. Okay, guys, so I have here a very good question. Whose ideas began the technique of hypnosis? And we have to know this name and remember it. It's Franz Mesmer. The uses of hypnosis and memory. Let's see the uses of this technique. I'm recalling some memories. Hypnosis is not a reliable remember approach. We can't here depend on this approach to help people remember details of a crime. Many psychologists argue that material recalled under hypnosis shouldn't be used as testimony in trials. So I can't use this for remembering something like the details of a crime. Hypnosis and pain prevention. Hypnosis here has been used also to help people what? Prevent pain. A similar effect can be achieved through relaxation techniques and breathing exercises. So I can ask the one or the person to do what? To breathe, to practice the breathing exercises. Okay, hypnosis and quitting bad habits. Therapists here may use post-hypnotic suggestion. Post-hypnotic suggestion, it means what? To help people quitting the bad habits. So the post-hypnotic, it means that the therapist do what? Gives instruction during the hypnosis. During the hypnosis, I'm going to give you some orders or some instructions for your best to carry out after and these orders or instructions the patient should carry out or do after the session has ended. Okay, so here I can recall and I can remember what happened during the hypnosis, right? How have the police made use of hypnosis? To jog the memories of witnesses to a crime, of course. Cultural diversity and psychology. Cultural diversity, what's the relation here? I have here visions, dreams, meditations,